how we as nurses can give good, clear, concise handover. Hello everyone and welcome back to my YouTube channel. My name is Zara, aka @NurseZara_UK, and I'm a registered nurse working in the UK. So today I'm actually doing something very different to what I usually make on this channel. It's something that I've been really passionate and wanting to do for quite some time. I've created this series called the Clinical Skills Series, and it's all going to be focused on nursing clinical skills. The approach is going to be more educational and more teaching based, where I go through different skills and essentially I teach it in my style, my way. In this video, I'm going to be going over nursing handover, how we as nurses can give good, clear, concise handover. It's a fundamental skill that all healthcare professionals need to learn and will be using that every single day in practice. So let's get started. What is handover? Handover is a communication skill that involves giving important details and information about the patient or about a situation that has happened to another member of the MDT. There are a number of different types of handovers that you will be exposed to out in practice, and these are: 1. Shift handover. This typically involves the nurse in charge from either the night shift or from the day shift giving details about every single patient in the unit to the staff that are going to be taking over from the shift. Number 2, bedside handover. One nurse going to the nurse that they'll be taking duty over from and getting the bedside care handover. So that involves going through observations, going through the drug chart, giving you additional information about the patient so that you can continue on with the patient's care. Number 3, patient transfer handover. This involves either you going to transfer a patient from your ward, from A&E, from your unit, or it could even involve receiving a patient from theatres and you are transferring that patient to the care of another nurse on a different unit or a different ward. And the last kind of nursing handover, perhaps the trickiest one as well, is S-bar. S-bar essentially is an escalation handover. You are escalating the care of perhaps a deteriorating patient or a patient you're very concerned about to another member of the MDT. This could be doctors, critical care specialist nurses such as CCOT. You need to give clear, concise handover really quickly and really effectively. That I'll actually leave for a different video, and we're just going to be focusing on the other types of handovers that I've mentioned already. Let's start off with this systematic approach. So you've been informed by the nurse in charge that you are to transfer your patient from A&E to one of the wards. When you arrive at the ward, you greet the nurse who is going to be taking over the patient care from you, and you are now going to give the handover for the patient that you have been looking after. The first thing that you want to do is you want to give the name of the patient, the age and gender of the patient, the day they came into hospital, and the reason they came into hospital. For example, this is Mr. Joe Bloggs. He is a 70-year-old gentleman who came into A&E this morning following a fall in his home. Following his emergency x-ray this morning, it has been confirmed that he has sustained an ankle fracture. Those are the key pieces of information that you should begin every single handover with. The second thing is any infection control precautions. For instance, are they MRSA positive? Are they VRE positive? Are they COVID positive? If so, when was their last swab date? Does this patient require a side room? Now, I have a bit of a story for this. I once received handover from a nurse who was going to be transferring a patient from a different hospital to the ward. I received the entire handover for the patient, and only right at the end, I asked the nurse, does this patient have any infection control precautions that we need to be aware of? She came back to me after 2 minutes, and in fact the patient was positive for MRSA. That meant I couldn't accept the patient because we didn't have a side room available at the time. We wasted our entire time over this handover only to realize at the end that this transfer cannot take place. So make sure you get the infection risk precautions details at the start of your handover and ensure that you can safely accommodate for the patient. In this scenario, Mr. Joe Bloggs has no infection risk and either be allocated to a bay or wherever is deemed appropriate. Make sure that you take the patient's full past medical history. What you may find is that whatever the reason the patient is coming into hospital with may have no relation to the history at all. For example, Mr. Joe Bloggs, whilst he came in following a fall and he sustained a fracture, he is type 2 diabetic, he suffers with hypertension, and he is also asthmatic. So even though he has come in with a different presenting complaint, you still need to get a picture of the patient's history, because you will also be tending to those needs whilst they are in hospital. So once you've taken the patient's past medical history, you want to then do something called plan of care. You want to start building more of a picture about the patient and their current situation. What has already been done for this patient, and what has been the decision made by the relevant medical team for the patient. The nurse can be handing over that routine bloods have been taken, an x-ray has been completed, and this patient is in fact for theatres the following day. They need to be nil by mouth from 2 a.m. and they need to have ongoing fluids. Because they are diabetic as well, they'll need to be commenced on a sliding scale. You don't need to tell the nurse everything that you've done every single hour of the day for the patient. Once you've got the plan of care for your patient, you then want to talk numbers. You want to start talking about the vital signs and the clinical observations that the patient has had whilst they've been in hospital. So you want to take what we call an A to E assessment. A to E assessment is an acronym that stands for airways, breathing, circulation, disability, and exposure. First thing is airways. Can the patient speak in full sentences? You really wouldn't be transferring a patient if their airways were obstructed. Like, that would immediately be an emergency call. Yeah. E is for breathing. Oxygen levels, respiratory rate, the patient's work of breathing. Are they currently coughing, or do they have any productive cough? Then you want to move on to C, which is circulation, and that's to do with the patient's blood pressure, their MAP, their heart rate, capillary refill time. You want to also know about their fluid balance, if they've passed urine, if they've had anything to drink. D is for disability. You want to check the GCS scoring, which is the Glasgow Coma Scale, their pain scoring, if they are diabetic, what their last blood glucose monitoring was. And some people also put the patient's temperature within this category, or they put it in the next one, which is exposure. Exposure is to do with the skin, what you're exposed to. Temperature can also go in this one. It doesn't really matter as long as you include it somewhere. Pressure areas are intact. Scarring or bruising that we need to know of. Any invasive devices, like if they've got any cannulas, if they've got a catheter, any dressings on. So those are essentially all the ingredients for your ATE assessment. And what the great thing about that is it covers such a wide spectrum of clinical observations all in this one systematic way. And if you follow that, there's kind of no way you can miss any important information for your patient. This is where you go through the drug chart or the formal prescription that should have already been written up by the doctors, and you go through that with the nurse. Now you're looking out for two important things here. One, does the patient have the correct medications in place for their care during hospital? For example, Mr. Joe Bloggs has come into hospital following a fracture. That sounds pretty painful. So does the patient have effective pain relief in place? The second thing, which is really important, is making sure that any medications that the patient is currently on. So remember, Mr. Joe Bloggs is diabetic, he's asthmatic, and he also has high blood pressure. So does the patient have all his medications already on the drug chart? Does he have his antihypertensive? Does he have his inhalers prescribed? So that's a lot of different things that you need to make sure are there, because that's part of the holistic care that you're providing. So go through the drug chart properly, do yourself a favor and make sure you ask those questions that has this been prescribed or not, and if it hasn't, not to worry, make sure you find the relevant team or the relevant doctor to get those medications in place for your patient. Part of your handover is actually physically going to see your patient as well. And when you're also going to physically see the patient, you need to also check the patient's pressure areas. I've been in situations where I have received a handover from a nurse, and when I then go and check the patient's skin and I find that they've got this bruise or a massive cut that wasn't handed over to me, that kind of becomes my fault because I should have checked with the nurse that was there. Make sure you check the skin of the patient and physically go with the nurse who's handing over to you for that information. Are there any safeguarding concerns? What the patient's baseline mobility was, and if the patient receives any additional support at home. For instance, are they being visited regularly by carers? It usually is a yes/no handover situation. Like, let's take our patient for example. Mr. Joe Bloggs is an elderly man. Yes, he does have carers who come and see him twice a day, and his baseline mobility is with a walking stick. And then the last thing that you want to know is if the patient has any property that's with them. Write down any valuables that the patient has come into hospital with. So particularly when they've come through A&E, the patient may have with them valuables like their wallet, any jewelry, the mobile phone. Within the chaos of coming to hospital, you tend to forget about those things. There have been so many instances where I have found on a patient a switched off mobile phone, and once we've charged it, they've got a gajillion amounts of phone calls from their loved ones. You know, those sort of things you need to take responsibility for on behalf of your patient. And guys, that is all. It sounds like a lot, but with practice and over time, this sort of thing can take less than 10 minutes. And if you're getting really good at it, it can take you even less than that. Follow this systematic approach. We're only going to provide the best possible care we can for our patients. This is the first video I have created in this series, and I really hope that you have enjoyed it. Hope you've learned from it. And if you've got any other contributions you wish to make, do feel free to leave some comments down below. Let me know if you found this video useful, and if you've got any other ideas of what you would like to see as part of this series, then do let me know as well. So that's all from me. Remember to like, comment and subscribe, and I will see you guys in my next video. Take care and stay safe.